Hello and welcome to New Mexico's Naturopathic Medical Show. I'm Dr. Wendy Van Dilla, naturopathic doctor and your host. In the studio today are two wonderful people. One, Doyle, who's our yoga therapist, recently moved to Santa Fe, New Mexico, and my wonderful nephew, Kelley Donahue-Van Dilla, who is going to be our guest client. And you'll recognize him from Michael Guzio's show on the Limpia, the spiritual cleansing, which I know a lot of you have watched. So we're going to get right into and have some demonstration about what Doyle does with yoga to help the athlete. So welcome on the set.
Thank you, Wendy. Kelley, I think we'll get started right away. So let's start standing on the yoga mat.
Okay.
I'm going to have you stand on this mat here, and you can face me. And we could do, I'm going to give you some of these balls, and if you'll take them out of their little tote. And working with athletes, it's important to work with, Kelley plays soccer, and so he has a lot of use of his lower body. So we're mostly going to focus on the lower body and use these yoga therapy balls. They're a hard rubber ball that really help loosen up muscles that get really tight and lead to injury. Also, muscles that are underused or misused, of course, can lead to injury as well. So in general, we start with the feet. So you can put one ball down. We'll just take one ball, go ahead and put it on the yoga mat. And I'd like you to have your heel on the floor, but bring the ball back as far as you can into the heel, into the arch of the foot, and then just compress. And this is going to start a deep tissue massage. So if you're running, walking, playing soccer, rock climbing, even using your feet, anything where you use your feet a lot, we've got to keep these muscles pliable. Common injury is plantar fasciitis. You don't have to be an athlete to get that. If you wear bad shoes, you can get it as well. And this is going to help bring more fluffiness to muscles that can get really tight. We work with connective tissue called fascia as well. And fascia dehydrated is like beef jerky. And we don't want that in our bodies at all. So this can actually fluff it up.
Say a little bit more about fascia.
Fascia is connective tissue in the body. It's this network of like a gelatinous substance in the body. But through use and misuse, underuse, abuse, it gets very dehydrated. And then it pulls on joints, muscles, and can be a real source of injury. So this massage, these balls actually function as deep tissue massage. Now, we'd like to get into the ankle joint a little bit. So take your toes, your side of your foot, and try to compress as best as you can as you go back and forth. And we bring some mobility to the ankle joint, making quick moves. You want the joint to be able to function.
Your foot should be as flexible as your hand.
Yep, definitely. We get so tight in the ankles. Yep, good. And now let's do the stripping. Try to press as much as you can and do the whole length of your foot. Yep, perfect.
That
Come
looks
on
like
up.
It feels really good.
Put your heel on the floor, but bring the ball up to the ball mounds of the toes. Compress. Now you have a little longer lever, and we'll work the ankle in a different way here. So if our ankles get stiff, guess what joint takes the impact? The joint above the knee. And the knees are one of the, most fragile joint in the body next to the shoulders.
Say that again.
The knee is the knee is one of the most fragile joints in the body, along with the shoulder.
And you can help take care of your knees by taking care of your feet.
Pause in the middle, Kelley. Now compress and hug the ball with your toes, and then spread your toes and lift them up. This is getting a lot of the extensor and flexor muscles of the foot.
That feels really good.
Is it? Nice. When do we ever do this with our feet? We put them in tight shoes instead.
Yes. Well, barefoot
Hold
walking.
your hands like this. You see how your fingers are naturally separated? Your toes should be separated when they're relaxed as well. Our culture doesn't really allow for that. Good hug. Perfect. Now come on back, and here's the front of your heel. Put the ball at the front of your heel. Your toes will be on the floor. Now we're right in the middle, compress. And then like you're scraping mud off your shoe, scrape to the inside. This is the plantar fasciitis massage.
Oh, wow.
To loosen up that tacky. So you scrape to the inside. We let up, come to the middle, compress, and scrape. correct. Good.
And what happens on your feet reflects all the way throughout your whole body. So
yeah.
you're doing a massage that's going to affect
Pause
your
in the
whole
middle.
body.
Compress, and now scrape to the outside. Now, you don't have to be an athlete to do this, right?
Right.
This benefits everyone in day-to-day life.
Oh yeah, you taught me to do this
Yeah.
for some back pain.
Now, come to the back of your heel. I call this stiletto heel. Do not wear stilettos, but if you have to and if you want to, you got to do this. Compress, and then you scrape back and forth. You can imagine if you're always in high heels, the Achilles tendon gets tight, creates bone spurs. Very painful to have a bone spur condition in the foot. You don't want to go there. Just a little daily maintenance. You can do this while you're standing at your desk, while you're in the kitchen. You don't have to like set aside time. And then let's add with a nice strip of the foot. You try to compress as you do that. In the beginning, the balls are a little bit awkward, but you get it down with practice. Perfect. Now, take the ball to the side. Bring your feet straight ahead. Close your eyes and compare the foot we just worked to the other one. And what might you comment how it feels?
My right foot feels alive.
Alive. Great. Other foot feels sort of
Sad.
sad. Okay, we had better do the other one, right? Don't want to leave you imbalanced. So we had the heel on the floor, and the ball is back as far as you can get the ball back. It's going to depend on the length of the foot, but we want to get that arch and compress. And typically we start with compression, just to get the muscle to start to relax a little bit. And then we did this eversion and inversion here in the foot. This is like butter in the joint.
Oh.
You want them to be mobile, fluid, and have the ability to move. Good job. Perfect. Then we went a little bit more forward, bigger lever, a little different action in the ankle. Compress. You have some good mobility in your ankle. That's really good, Kelley.
I noticed Kelly's
Pause.
toes are already separated.
Yep.
Just standing there.
Good.
He's been working on his feet.
Yep. That's what you want. Good job. Keep working on them. Because as we get older,
Oh
you have to
God,
work
people have so
more.
many foot problems.
And this actually is like a really good, feel-good way to work. Some of the stuff that we're going to do will be a little more intense. All right, now take the ball back to the front of the heel bone and go ahead and compress. And this is where we scrape, like you scrape gum off the bottom of your shoe. Compress and scrape. Good. This is the plantar fasciitis seat here. And that's just fascia that gets very dehydrated, strained.
I'd like to warn people that when you first start doing this,
Compress.
it hurts like heck, but it hurts good.
It hurts good.
And the more I do this, the
Good.
more my foot
Yeah.
relaxes and it feels good to start with.
And you'll find this throughout the whole body. In the beginning, it's like, you have this sort of reaction. If you can just relax the face, especially, you're not mapping that pain through the rest of your body. And then as things get more ability to hydrate, you'll have less of that experience. Go to your stiletto heel, and you compress in. Go at it. You can spend a little more time than Kelley and I are spending here, but I wanted to show these foot pieces. Perfect.
Well, as my 97-year-old father has found,
Can you do this?
the two W's are really important in life: walking and water.
So here we're just doing some massage on the top of the foot as well. We didn't
That
do this
looks
on the other
cool.
side. I know. We didn't do this on the other side,
It's like a
but
ballet
we'll
move.
be okay. All right, awesome. Very good. Come down to all fours. And for this next one, go ahead and put your balls in the tote. So we're focusing pretty much on lower body for athletes here. And if you do a lot of running in your sport or just your fitness activity, there's a lot of fitness enthusiasts who aren't in organized sports, you can get shin splints. And shin splints is muscle fascia pulling away from the shin bone.
Say that again. 'Cause I had shin splints when I was a teenager running track, and my coach had no idea what they were.
Yeah. Well, muscle attaches to bone, right, through tendons, and as with impact, a track should have a little bit of give, but still if you're doing a lot of it, with impact, it pulls away from the bone, and that's the strain.
Ouch.
And this can happen from repetitive motion and just not being hydrated enough, or just lots of impact. The body can only take so much.
Yeah.
So here's our deep tissue massage to get that pliable so it can hydrate and heal. Looks like this. So you can just copy me, okay? So I'm going to start the ball up near the base of the knee and compress. And then you scrape all the ways down to the ankle and go back up towards the knees.
So you're, oh, I see. You've got them in the bag. So you're doing two
In the
balls
little
at
tote,
once.
and that shin bone, the tibia is right in the groove between the two balls. So we really are massaging muscle on either side. How's that feel?
Intense.
Intense, yeah.
Good.
Good. The intensity indicates that this is an area that needs a little bit of this kind of massage.
Oh, yeah.
And certainly if you're running a lot.
Well, our body doesn't, for some
Let's do the
reason,
other side.
doesn't have good circulation in the front of the shins.
Uh-huh. So compress as much as you can. And one thing in yoga therapy, we work a lot with feedback from the client. It's not a cookie cutter. So you tell me how much, you decide for yourself, you're in your body, how much do you compress and get a deep tissue massage. Here. Really good. Great. All right. Moving
So that's
right
a good
along.
point. This is very much driven by your own sensation.
Yeah, by
client's
the client.
sensation.
Feedback from the client is how we work.
Now, sometimes the client doesn't have good sensation, like with diabetes and nerve damage.
I probably wouldn't do some of what we're doing here with the athlete with someone who's more involved. Yeah, would work
That's a good
differently. So to your point, instead of weight bearing, the diabetic person might just roll here. And some of the stuff we do with Kelley on the floor, you can actually do standing at a wall, and there's less weight bearing on it. So here we
Great.
go. All right, next, take your ball out of the tote. And we have different sized balls. I'd use the bigger balls on some bigger people, and for bigger parts of the body, we use them. So these are the hamstring tendons behind the knee. And any tendon is, if you can imagine, there's muscle interlaced within all the muscle is the fascial tissue, and it all comes together and forms the tendon that goes over the knee, and then also the same in the hamstrings. This happens all through the body. So put back here, can you feel this tendon on the inside? Put the ball right on it. It's called knee chew. And so the ball's not in the middle of the knee, it's right on that tendon, and you close your knee.
Wow, that looks intense.
And you decide how much you go there. You might have to hold it in place. Yeah. Now check this out. Can you contract your calf and then release it?
Ooh.
Contract. It's one of the techniques. Contract and release.
Oh, wow.
You feel that massage? You can see his muscles. Way to go. Contract, release. Now, go ahead and contract. So this, when you contract and hold it, it's called pin. Then we're going to mobilize. So you come up on your heel and move your ankle side to side, and that's more of a cross fiber massage. You see that? I'm pinning and then mobilizing.
This looks like really good knee replacement surgery prevention exercises.
All this was prevention for that kind of
Prevention,
surgery,
oh
let
my
me tell
gosh.
you. Next, other side, hamstring tendon. So you get it right on the tendon, called knee chew. And the first thing we're going to do is compress, contract, and release. Contract and release. So this is a massage along the fiber of the muscle. And then the second action will be cross fiber.
And
Not
this
the muscle,
is
the
this
tendon.
is not the type of therapy that the orthopedic surgeon knows about. He or she knows about cutting and what they
Yeah.
can do in an operation room. This is the type of stuff we can do ourselves.
Yep. definitely. This is all of the work of yoga therapy is to teach the client how to help themselves. And so it requires someone who's motivated to want to do stuff on their own.
Yes.
But, you know, you can pay.
You can pay now or you can pay later.
Pay now or pay later. I'm a fan of all kinds of practitioners. So if you're someone who does deep tissue massage and you do this in between your massages, you'll go deeper when you go see your practitioner. So it's an advantage to the work that you already do. It doesn't have to be either or. In fact, the more we can work together as alternative practitioners, the more we serve the client.
Say that again louder. The more we can work together
as alternative practitioners, the more we serve our client.
And the MD world is excellent at networking with each other. The alternative world is learning.
I agree. Yeah. Okay. We should do the other side. Oh wait, we have to do our pin spin. So I have to hold mine in place, which tells me I need to work this tendon a little bit more. It keeps popping out. So here we're contracting, and if you need to, you can hold with your hands, and we're mobilizing the shin and the ankle to do a cross fiber massage.
Ooh.
So this work for athletes, it helps eradicate pain. It helps improve performance. So you can imagine when you go back on the
Kelley,
field.
what does that feel like?
You get some movements across.
Feels like a deep tissue massage in my calf.
Because, yeah. We didn't do the calf because it's a little bit awkward to do.
Can you feel it all the way down your calf? Because a lot of times you can be reflexive in what you're doing with the body.
It feels pretty local to me.
Okay.
All right. We should do the other side, huh? For Kelley's sake. Contract. Contract, relax. Contract, relax.
And the relaxing is just as important as the contracting.
We want muscles to know how to do both. A muscle in a state of contraction keeps going that direction, and then this is trigger point in pain. So a muscle at rest, we want it to be in a resting state.
And our body can train our mind how to do the same thing. Our body can train our mind to relax.
Tendon. Yeah.
And let go of anxiety and depression.
Last night, watching the World Series, I worked on my knees.
Oh, good. Excellent time.
I have my balls out there. It's, you know, it's not like you have to say, I don't have time to do this. You do it when you're doing other stuff. And that's what I really like. You can take them to the office. You can have them in your car.
Yes.
I put some behind my back. You'll find points where you know you need to release. Let's do some pin, spin, and mobilize.
And seriously, when you're working with one part of the body, you work with
really
all
rotate,
levels.
yeah. Good.
You're working with your body, you're
Nice.
working with your mind, you're working with your spirit,
Okay, we're going to move on just because.
and your emotions.
Here's what's next. So the quadricep will work, but it comes down tendon over the patella, and it can really influence how this patella tracks. And there's a very painful condition.
You know about
right
that.
now, chondromalacia. I had an injury a long time ago in a time where all we did was wrap the knee in an ace bandage, and then you went on and it felt okay. But what it did, and I didn't know until I got an x-ray, it shifted the kneecap lateral over here. So over time, as I aged, these muscles got weak and this got very tight. So my work is to really loosen this and strengthen here. But for Kelley, there's this pocket for all of us of where all the 4 quadriceps attach to the tendon go over the knee, and it can get pretty intense. So I'm going to show you here.
Let me say one thing, Bea.
Yes.
That when you, I have a similar injury that my kneecap has been pulled off to the side for years and years and years, and that damages, if it's not tracking in the same place, it damages the cartilage.
Exactly.
And causes pain after a while.
And then this is osteoarthritis of the patella.
Yes. Osteoarthritis of the patella,
so
which is the kneecap.
this ball is going to be above the kneecap. And then you decide how much pressure, and you're going to go back and forth. You see, I'm going to roll across first. Wow, this feels a lot better than it felt last night when I did it. Encouraging. All right, so it's like the eyelash of your kneecap.
The eyelash of your kneecap. It's a cool term.
Go ahead and try. So it's basically going to roll across there. Above the kneecap, try to compress back and forth.
Wow.
Yeah.
What does that feel like?
Good, intense.
Intense,
Yeah.
yeah.
Good.
You'll be surprised. It doesn't take a whole lot. Like when I did this last night on my knee that's involved, it was killer. And I'm like, okay, I haven't been doing this, and I really need it on this knee. And it was different on the other side. But this morning, it's a lot better.
A lot better.
So that tells me I'm going to keep doing it to keep it in that state.
And
Go ahead
that's,
switch
that's
to the other
good
knee.
because we can do a little bit often and have a big
Yeah.
impact.
Especially with the clients I work with who are older or a little bit more involved, it's baby steps over time. Really makes a difference. And you start to feel like you have this new normal. And then you recognize, like you can't change a pattern until you're aware of it. You know, I've found. And so this baby steps over time brings the awareness in the body where you recognize, oh my God, I'm really rounding, I have a C curve in my back. I didn't know that I did. But in class, we work to bring a natural curve or with clients, and you start to become aware, oh, I've slumped. All right.
That's in Tibetan medicine and other
Here's
medicines.
what's next.
The root cause of disease is ignorance.
Yeah.
If you're not aware, you don't know to
something
change.
until you know it. All right, here's all the lateral stuff. So, but just a little bit here. So, it's pinning,
Wow.
mobilizing, okay? And then we're going to do a little rock and roll. Okay? So,
Now you
right here on the
mentioned-
lateral knee, right here.
So on either side of the knee.
So, we've really addressed ankle and knee health so far.
So to do this at home, do you have to have a big enough space like we have here?
You only
On
need the
the
size
floor?
of a yoga mat, really. I mean,
So
you know, my
a
living room floor.
hallway
A hallway can work.
or the middle of a room and then
So
roll up the
now,
mat?
this is the leg. You move forward and back because you want to massage underneath there.
Wow.
I'm going to lift this leg up a little bit. There you go. This leg moves.
And
This
Bia
one's
does
compressed.
private sessions, she does classes, she does workshops, and we're really lucky to have her in Santa Fe now. She used to be in Albuquerque, but she fell in love with a gentleman who lives up here, so we got her up here now. And she had a very successful business in Albuquerque and sold it, right? And it's
I
still
did. I had a
happening?
yoga studio for 10 years and always worked therapeutically, had a therapeutic thread at the studio, but also it was a regular studio with 30 classes on the schedule and 15
my gosh.
teachers. And
Wow.
I brought in guest teachers and trained teachers. And now in this next evolution, I'm working 100% therapeutically. And when I say therapeutically, it's preventative as well as restoring after injury or repetitive motion or just life in general and aging. So it's not just injury, it's definitely...
And kids can do yoga therapy?
Okay, now pause.
Elderly?
Can you do just rotating in and out?
Not
The
just...
bottom leg.
The bottom leg. This is just like weight. With the knee bent, you can do this little rotation. Good. Go ahead and flip over. Let's do the other side.
I mean, Kelley is
So-
very fit.
He's very fit.
He's in good fitness. And this kind of thing can be helpful to all of us. Anybody that has a body.
I'm really, you know, a lot of us, myself included, I'm turning 60 and so I'm freaking out. So I put a lot of my attention on looking at people who are fit into their older age for inspiration. And I found a video of a 104-year-old woman driving her car up to the yoga studio and going to her yoga class.
Wow.
And the way she moved in her body, you know, so I put that on my Facebook page. This is
Wow.
me. Oh, I'm going to be teaching the yoga class, you know, at 104. But I want to move with that same grace.
Well-
So this is addressing when I talked about how my kneecap went over and this got really tight, and it's going to help loosen up this retinaculum and all the connective tissue. And it's already, the x-ray showed it was off by an inch. It's already over at least halfway now. And Wendy and I are working with the cold laser to help with the arthritis condition underneath.
Say that again?
Wendy and I are working with the cold laser procedure, which can help regenerate this tissue that we're working with here. Because I've
Excellent.
had years of this mistracking and not really getting it. You're not aware of something until you are.
And I'm working on producing a show about the cold laser.
Okay, I'll be your
So,
model if you want.
Tune in.
Okay.
Stay tuned.
There you go. Let's pause. So this is knee
And-
health. Take your balls out. And we're going to just work with the big one. You're
We,
going to
we got a
tell me
couple.
time.
We got a couple more minutes.
Okay, we'll just do the quad. So I'll show you first.
Because
we
I
have
want
just one
time
of
for
these.
Kelley to tell us about his tattoo.
Okay. This can be the last one.
Okay.
And that'll be a really nice focus
We got
on-
another show coming on this, so don't worry. She's coming back.
Oh my goodness. So here's your position, Kelley. Do you see I'm up on my toes? You can rest your forehead. And I'm going to, oh my goodness, have you do things like this and this, so cross fiber.
Oh my gosh.
Oh my goodness. And we'll do this in a couple different places on the quad, or maybe in the name of time, just one place on each quad. So you find a spot on your quad. Anywhere is fine because you can move it all around. And just pause with toes on the floor to start. Knees on the floor, forehead on your hands, and you can
We
tell
may
us how
need
intense
a
that
little
is,
bit more
'cause
time.
He's, so I like what he's doing. He's recognizing it's intense, and he's not doing full weight on it, because you're in your body, right? Not me. Now, can you bend this leg up? And then tap the foot down. So this is pin and mobilize, right? We're pinning. Pretty intense, right?
Should my stomach be off the ground, or?
It can all relax on the ground. Yeah, good. This next time, pause with the knee bent, and then this is the cross fiber.
Wow.
Yeah. This is an indication that your body needs this.
Whoa.
Yeah, good job.
'Cause most
And it gets better
athletes-
with practice, and then your muscles will perform better for you.
And most athletes focus on strength, not relaxation and taking care of their muscles.
Yeah, over time though, that fascia gets so bound and you lose performance in the
Yeah.
muscle. It's
This is
a
important
great
to help
adjunct.
keep
Let's go to the other
performance
thigh. And we'll finish up with this one. So in the next segment, we're going to focus mostly on back care. This is more focused on what the athlete can do to stay vital in his or her body. Yeah, so he's pinning and mobilizing on the muscle. It's going to be so much
This
happier.
has been a great demonstration. And please stay tuned. We will have another show.
Pause.
This is Bia Doyle
Cross
here in
fiber.
Santa Fe. And this is my wonderful nephew, Kelley
Great
Donahue-Van
model.
Dilla, doing great demonstrations for us. Thank you, George and Dottie, for running camera. Thank you, George and Doreen, for the station. What? Do I still have some time left? Harvey and Dottie running camera. This is Dr. Wendy Van Dilla, naturopathic doctor, and we will have another show with Bia and Kelley to talk about taking care of your back and using yoga therapy for that. And we'll get Kelley to tell us about his tattoo on the next show. Thank you very much.